Welcome everyone to a journey into the complex world of complex regional pain syndrome, or CRPS. This debilitating condition affects the nervous system and can cause chronic, often excruciating pain. In this video, we'll explore its causes, symptoms, diagnosis, treatment, and current research, offering insights into managing and understanding this challenging illness. The exact cause of CRPS remains somewhat of a mystery. It typically develops after an injury, such as a fracture, sprain, or even a minor bruise. However, the pain experienced in CRPS is far more severe and prolonged than would be expected from the initial injury. In some cases, CRPS can develop without any identifiable triggering event. While the initial injury is often a precursor, it's important to remember that not everyone who experiences such trauma will develop CRPS. Researchers believe that a combination of genetic predisposition, immune system dysfunction, and nervous system abnormalities likely play a role. The pathophysiology of CRPS is intricate and not fully understood. Current understanding points to a disruption in the way the central and peripheral nervous systems process pain signals. This disruption can lead to a cascade of events including abnormal inflammation, altered blood flow, and changes in the structure and function of nerve cells. The sympathetic nervous system, responsible for regulating things like blood pressure and heart rate, seems to play a key role, often becoming overactive and contributing to the pain and other symptoms. Additionally, there's evidence of neuroplastic changes in the brain and spinal cord, meaning the nervous system rewires itself in response to the persistent pain, potentially amplifying the problem. Estimating the precise prevalence of CRPS is difficult due to variations in diagnostic criteria and potential underdiagnosis. However, it is considered a relatively rare condition. Studies suggest that CRPS approximately 26 people per 100,000 individuals annually. While it can occur at any age, it's more common in women and tends to develop between the ages of 40 and 60. It is important to note that anyone can be affected, and awareness is key to accurate diagnosis and timely intervention. The signs and symptoms of CRPS are diverse and can vary significantly from person to person. The hallmark symptom is intense, burning pain that is often described as disproportionate to the initial injury. This pain is typically localized to a limb, such as an arm, leg, hand, or foot, but can sometimes spread to other areas of the body. Other common symptoms include swelling, changes in skin color and temperature, increased sensitivity to touch, allodynia, pain from normally non-painful stimuli, hyperalgesia, changes in hair and nail growth, stiffness, tremors, and muscle weakness. These symptoms can significantly impact daily life and functional abilities. Diagnosing CRPS can be challenging, as there is no single definitive test. The diagnosis is primarily based on a clinical evaluation, which involves a thorough medical history, a physical examination to assess the presence of characteristic signs and symptoms, and the exclusion of other conditions that could be causing the pain. The Budapest criteria are commonly used guidelines to aid in the diagnosis. Additional tests, such as nerve conduction studies, bone scans, and sympathetic nerve blocks, may be performed to further evaluate nerve function and rule out other potential causes. Early diagnosis is crucial for improving treatment outcomes. CRPS is typically classified into two types, Type 1 and Type 2. Type 1, formerly known as reflex sympathetic dystrophy or RSD, occurs after an illness or injury that did not directly damage a nerve. Type 2, previously known as causalgia, occurs after a distinct nerve injury. The signs and symptoms of both types are similar, but the presence or absence of a confirmed nerve injury differentiates them. Treatment for CRPS is multifaceted and aims to manage pain, improve function, and enhance quality of life. A combination of approaches is often necessary, and treatment plans are tailored to the individual needs of each patient. Common treatment modalities include pain medications such as NSAIDs, opioids, and nerve pain medications like gabapentin or pregabalin. Physical therapy and occupational therapy play a crucial role in restoring mobility and function. Nerve blocks, spinal cord stimulation, and other interventional pain management techniques may be considered for more severe cases. Psychological support, including cognitive behavioral therapy, can help individuals cope with the emotional and psychological impact of chronic pain. Early and aggressive intervention is key to maximizing treatment effectiveness. Currently, there is no definitive way to prevent CRPS. However, some strategies may help to reduce the risk after an injury or surgery. These include early mobilization, adequate pain management, and vitamin C supplementation after certain types of fractures. Research is ongoing to identify specific risk factors and develop more effective prevention strategies. The prognosis for CRPS varies greatly depending on the individual, the severity of the condition, and the timeliness of treatment. Early diagnosis and intervention are associated with better outcomes. Some individuals experience significant improvement with treatment, while others continue to experience chronic pain and disability. Research into new treatments and therapies is ongoing, including studies exploring the role of inflammation, immune system modulation, and novel pain medications. Advances in neuroimaging and understanding of brain plasticity offer hope for more targeted and effective treatments in the future.